Good morning, ma'am. My name is Branjar Asi, and I'm a student nurse from the Adventist University of the Philippines. I am assigned to handle your care for today, and I would like to tell you that I'll be doing a series of questions. I'll be asking you questions that involves something prior to what you have been experiencing. So rest assured that everything that you will be telling me that you'll be telling here will be kept confidential within me and the healthcare team. So, are you okay, ma'am? Do you need anything?
No, really, I'm good.
You're good. Is the temperature alright?
Yeah.
Do you need to go to the bathroom before starting?
No.
Are you hungry? Do you need food? Do you need water?
Kinda hungry, yeah.
Kind of hungry? Okay, I'll be bringing you food later. So, I'll be assisting you in taking your vital signs now. Assuming that your vital signs are normal, I will now proceed in asking you questions regarding things prior to what you've been feeling. So, may I ask what's your name, ma'am?
My name is Nicole Ann Arrogante. I'm 19 years old.
What is your religion?
I'm a Seventh-day Adventist.
Okay. So, may I ask you where you've been residing right now? Where do you live?
I'm currently residing inside here, the campus, AP campus.
Okay, so you've been staying here. So, I see that you're wearing a uniform. So, in which school are you from? Or have you been studying in school?
Yeah, I'm actually studying here, first year nursing student.
First year nursing student. Okay. So, um, let me ask you what brought you here.
So, few days ago, I've been experiencing a headache.
Oh, so you've been experiencing headache a few weeks ago. To be
Few
exact,
days ago.
a few days ago. Okay, so you've been experiencing headache. Um, may I ask you, how would you describe the pain that you've been feeling?
It's like something piercing through my head, at the back part of my head, at the occipital part.
Okay, so there's been piercing. So, um, how would you like? How often do you experience the pain?
It's usually it's every day, but it's not continuous. It occurs and then sometimes it's more severe.
So it occurs and reoccurs. So that's like the pattern.
Yeah.
Okay.
And sometimes it's more severe than the last time, or sometimes it's tolerable.
Okay, I see. So, may I ask, in what location do you experience the pain?
Usually here at the back part
Oh
of my
yes,
head.
back part of only there.
Yeah.
Okay. So, when you're experiencing the pain, how long do you think it stops?
It lasts for like a few minutes, and then sometimes, oh yeah, just a few minutes.
Okay, so
But it keeps on recurring.
so for a few minutes. So, in a scale of 1 to 10, how would you rate the pain of your headache?
It really depends. It's not a constant pain, I guess. It's like sometimes it's more tolerable, like a 4, or sometimes
4.
6. Yeah.
Okay. So, aside from the headache that you've been experiencing, what else do you like experience?
I
Because
noticed that sometimes um, when I shift my focus from one object to another, especially when I suddenly shift my attention or my focus, I get dizzy or nauseous, and sometimes my vision is a bit blurred.
Okay, so blurry vision. So, based on what I've seen or what I've gathered, may I ask, any, um, is there a time where you've been hospitalized for the past few months?
No, I have never been hospitalized.
Okay, you've never been hospitalized. So, how about, let's say, based on what you know, your family members, is there any hereditary sickness that have been passed from generation to generation?
Um, both of my both sides of my parents really. I think ano ba? Asthma and hypertension.
Okay, asthma and hypertension. So, which part of the family, which family side do you experience hypertension? Both?
Both.
Both. Okay. So, you've said that you are a student, right? So, may I ask what's your daily routine as a student?
So I usually wake up at around 5:30 a.m. and I go to class at 7 a.m. and I usually skip breakfast
Okay.
and my first meal of the day is at around 12 p.m. Yeah, but I do eat snacks from time to time.
Okay, so you've been eating snacks and you've been skipping breakfast. So, how about prior to your sleep? How much time do you sleep?
At around 6 no 6 to 7 hours. Yeah.
6 to 7 hours. Do you sleep early? Around what time do you sleep?
Not really. I sleep at around 11.
Oh, okay. So you slept at 11. Um, aside from that, how about your water intake? How much water do you intake a day?
I usually drink 6 glasses of water, but
Six
yeah,
glass.
it's not an exact measurement. Yeah, but around like that.
Okay. So now that I've gathered some of the information prior to what you've been feeling, I'll now be running through the other systems of your body. So, um, may I ask, what else do you been feeling? You have blurry vision, right?
Yeah.
So, aside from that, do you have problems in your hearing?
No.
Do you have like fever recently?
No.
You have chest pain? You've been experiencing, let's say, abdominal pain?
No, not really.
Okay. So how about in your lower extremities? Do you like experience any pain?
No.
Okay, so there's none. And I've seen that you're wearing glasses. So, are those glasses prescription glasses?
Yes, I think I got this like a year ago,
So a year ago,
and I also have astigmatism.
so you have astigmatism. Okay. So, now that I've got the information that I needed, I'll now be running through it once again and be summarizing you um, the information. You're Nicole Ann Arrogante, 19 years old, which is an SDA, and you live inside the campus. The few days you've been experiencing headache, specifically a piercing pain in the back of your head, and you've been experiencing it every day, right? So whenever I said an information wrong, you can freely correct me, okay? So the pain that you've been feeling is, you said that it's tolerable and it occurs and reoccurs, right? So aside from that, you've been having blurry vision and sometimes dizziness and nausea. Okay, and on your history, family history, they have both asthma and hypertension. So thank you, ma'am, for answering my questions honestly. Thank you for your cooperation. Um, Once again, rest assured that every information that I've gathered, that you've said, will be kept confidential within me and the healthcare team. So as I proceed, I will now be giving the information, and whenever you needed something, you can just call me and I'll just be right here, okay? So thank you, ma'am.
Thank you.